Welcome to another episode of Exercise Matters with me, Randall Cooper.
And me, Mick Hughes.
Support from today's podcast comes from Premax Performance Skincare. If you're active, you focus on strength, endurance and recovery. But what about your skin? Sweat, friction and the elements take a toll. That's where Premax comes in. High-performance skincare made for high-performance people. From recovery creams to anti-chafe balms, massage creams to exercise-specific barrier creams, we help your skin go the distance. Keep your skin as fit as your body with Premax. Available now at premax.co.
And support for today's episode also comes from Learn.Physio. Now, health professionals, are you staying ahead of the game? Learn.Physio brings you cutting-edge education from world-class experts in sports and musculoskeletal medicine. Online courses, hands-on practicals and expert resources backed by the latest evidence and designed to fit into your busy schedule. To be your best, learn from the best. Get started today at Learn.Physio.
Well, as you can tell, we're definitely doing this live and it's all amateurs and it's one-take wonders. I'm sure when we get 20 episodes in, Mick, I think we'll get a lot better at this.
We'll be very, very polished. Yeah. We'll be able to remember. It won't even have to have our scripts.
No, that's it. We'll all be just top of our head, but we've got a way to go. Anyway, today, let's talk about musculoskeletal screening. I really enjoyed last episode. And for those who haven't listened to it, these two episodes, I think, go really nicely together. Last one was on injury prevention programs and prehab. This one's on a topic which we call musculoskeletal screening. So musculoskeletal screening is a structured assessment of your muscles, joints, and movement patterns to identify potential injury risks and also to help optimize your performance. So again, it fits into this preventative type of model where what we're looking for is to try and detect like weaknesses or imbalances or movement inefficiencies before they lead to injury. So it's not really about diagnosing conditions per se. It's really about trying to identify problems or areas in your body that could be prevented, given some preventative strategies to make sure that you prevent those injuries, but also optimize your practice as well. Mick, I know that with your sporting team work, I'm sure you did some screenings and stuff, but what about up in Townsville where you are? Does your practice actually do these as a service to the community? Do people come in and actually come in for a screening?
I don't particularly myself, but I do know that a lot of mining workers, the mining industry, some other industries where there's a lot of physical demand and heavy labor being required. So, say council workers or construction workers that are, like a big sort of corporation where they're really looking to minimize the downtime of their workers and potentially look after any potential injury risk. There's certainly some musculoskeletal screening that does get done. And I've certainly, previous time up here in Townsville, I would often do pre-employment screening to look at a number of different things of the people that were walking in. I think one of the interesting, probably one of the big ones was, yes, we're looking for any potential things that may arise, but also having a look at what has happened to the person in the past. I think that's also too a really important part of this musculoskeletal.
Yeah, I agree. I remember back in the day, like when we spoke about this in the last episode about injury prevention programs, how early in my career, and I'm definitely showing my age here, was kind of in its embryonic stages. The same went for musculoskeletal screening. And I remember working with high-level professional athletes. The screening protocol would be 5 pages long. And essentially, like we would be going from basically the top joint of the neck down to the bottom joint of your great toe and just looking at every single range of motion, manual muscle strength testing, essentially doing a systems check. Fortunately and thankfully, it's been refined over the years. And I think what's happened is that we've really started to hone in on what's that person's injury history. So for instance, if someone's had hamstring injury in the past or an ACL injury in the past or unstable shoulders with swimming or something like that, then you focus in kind of on those areas and do more testing of those regions. I think also that it depends on the activity or the sport that people do. So you use the example of like your mine workers, which are athletes, they've got to use their body all day, every day.
100%.
obviously their backs and their knees and their hips have got to be assessed. But if you play golf or you play tennis, then like your elbows and your shoulders are going to have to be assessed really well as well. So we've
Yep.
become a lot more focused on the injury and the person and the activity that they do, rather than it just being a kind of a global check for everyone. I think the other thing that's really crept into musculoskeletal screening in recent years is functional movement. So rather than just testing a knee and seeing how much it can bend and flex and whether the ligaments are stable or unstable, we're really now starting to look at how does that person squat? How does that person jump and land? How does that person hop? How does that person kind of move? And I know that even with my work with with athletes over the time, is part of what we'll do sometimes is actually just videotape these athletes performing training and just seeing whether we can pick things up and discrepancies or imbalances, or whether they're protecting one side versus the other. So it's become a lot more nuanced and not as overbearing. But going back to my question about does your practice do it? I know that there are a number of practices out there that do it. Generally, they're done by physios and sports physicians and strength and conditioning kind of coaches as well. And the analogy is always is that if you take your car in for a service and you're getting things checked up, why wouldn't you do the same with your body?
Yep. Yeah, agree. I think there's definitely some things to be looked at. And the interesting thing also too, it's emerging side of injury, I guess, risk mitigation and having some screening processes done is also looking at family history. And in particular, ACL is obviously the thing that's front of mind for me. But we know that, yeah, certainly your parental and the genes that you inherit off your family members can increase your risk, and the quality of your collagen, which is passed on through your bloodline and through your families, is certainly something to be considered. But also to systemic problems, like people that have rheumatoid arthritis in their families or other kind of inflammatory conditions that certainly get passed on from generation to generation. It can certainly play out in what injury profiles you will see as an athlete. So yeah, it's a pretty interesting area, the whole screening process. I guess the big question is if we are screening, does it equate to, I guess, and we'll dive into this a bit, but does it actually equate to any losses of game time or injury time? So that's probably the big one up for discussion.
I'm going to leave that to the end, Mick, because there's a bit to discuss there, but I'd like to kind of go through
100%.
maybe a few other things to start with, but it is the
Let's go.
question, so we definitely need to tackle it. So I think that, like screenings really started in elite sport. Now they're for everyone. We touched on the workers in the mines. I think that one of the most key groups for people who need screening is young athletes, young people. And the reason being is that these guys, or these kids, I should say, are growing rapidly. And I don't know if you've seen it in your career, Mick, but usually like I will see when kind of adolescents, particularly going through growth spurts, is their bones are the things that grow first, and then everything kind of catches up. Muscles, soft tissues, neuromuscular, coordination, function, all that kind of stuff. And I've seen it over the journey where some people, you have a 13-year-old that looks really good and they've got nice proximal control and stability. They come back, 9 months later or 12 months later, and they've had a growth spurt, and they're all over the place. They look wobbly. It's like, what's going on? And you realize that they've grown 8 to 10 centimeters in that time. So I think that as people are growing and maturing quite quickly, the recommendation from some people out there and in the research world is that these young athletes need to be kind of tested once every year. Whereas people who are kind of more mature and maybe 25 or 30-year-old kind of athletes tend to kind of know what they're dealing with at that point, and the screening should be done every 2 to 3 years at that point. The other group that's really interesting, I'll get you to make a comment on this also, Mick, is people who are returning from injury, because when you have particularly like a significant injury, let's say it's a bad bout of lower back pain, or you've had a shoulder reconstruction or a knee reco, not only are you taking time out of the sport where you're getting deconditioned, but it also really lends itself to muscle imbalances and a drop kind of like in all sorts of things all over the body. What's your reflection on that?
Yeah, like it's making sure that, obviously my patient list at the moment is very ACL heavy, but it's with these particular people, I look at when someone's returning back to, say, running, because these people won't run for 5 or 6 weeks, sorry, 5 or 6 months in some cases, and knowing that they haven't done any significant work there, I'll be constantly looking and assessing and screening them for, what's their calf capacity like, what's their hamstring tolerance like, because these are the things that will likely go ping when they start going again. So I think it's for people out there, and this just doesn't equate to ACL injuries, it's any significant injury. You've got a person who's got a rotator cuff repair and their arm's in a sling for 6 weeks. They then are 6 weeks of just active assisted range of movement to a full range. And then now we start doing cuff work at, week 12 and onwards. That's a huge layoff where often that person's not running or any kind of high intensity cardiovascular work. So once again, having an idea of what can be the knock-on effect to these people from a significant layoff. Ankle fracture's another one, whether they're, in a moon boot for 6 weeks or an Achilles tendon rupture, we're in a moon boot for 12 weeks. Like, I think for us as health professionals and exercise professionals and the greater, wider audience is that when you are having a significant amount of time off from the things that you like doing, and we're talking as little as a 1 month off your regular exercise patterns, we are now going to be up against it to just naturally fall into what we've previously done. We will see declines in the muscle adaptation. So what makes our muscles spring and bounce and is effectively a protective effect, that started to degrade after a month of decreased physical activity and absence of that stimulus. So we just need to keep a really wide view of that. Yeah, that's what I've seen.
Yeah, I agree. I think you make a really good point. And the point is that particularly when we're talking about injuries here, and this is an exercise podcast, so we're not going to always talk about physio stuff, but I think that like when people have been laid off for a while, whether it's injury or whether it's just they've gone on holiday and for 6 weeks or something along those lines, a big factor to prevent injuries is to ensure that you've returned to your baselines. So like with ACL research, for instance, like we really try and advocate for people having done hop tests and single leg strength work and counter jump movement tests and whatever, so we can kind of get a baseline of what's normal for them. And when people have had an injury, I think it's important not only to kind of go through some of these screening assessments to make sure that we're ironing out muscle imbalances, tightnesses, joint range of motion issues, neuromuscular control, but we're also making sure that if you've run 2 kilometers in 7 minutes in the past, are you at that aerobic efficiency again? Can you run 7 minutes for 2 kilometers if you're a footballer? And if not, and you're running 8:30, then you go out and play football again. Well, you're an absolute Monty to kind of do your hamstring or your calf or something like that because you're not at the level that you were. Whereas you might look at neuromuscular control and the way that they can kind of single leg squat, etc., and go, oh, you look really nice, but other measures are down as well. So it does take a lot of assessment to ensure when someone's ready to kind of go back to sport again. And part of that is the injury. Part of that is also screening for other things that could potentially go wrong.
Yeah, a bit of a caveat to that also too is you said before the 25-year-old athlete probably doesn't need to be sort of looked at so frequently, but I think the other thing on the flip side of that is that the 25 to 30-year-old athlete who is having an extended period of time away from sport due to a long-term injury, they're the ones that probably need to be looked at a lot more carefully and diligently, because as we get older, our ability to maintain strength, our plyometric properties and all the things that allow us to do fun things start slowly. It's like you turn 28, 30 and you have to hand in your athletic card and you now have to work harder to do the fun stuff. And I've seen that so many times where I'm meeting these men and women who in their late 20s, early 30s are, having long-term injuries and just expecting they can just roll up next week like they were an 18-year-old and jump back into sport. And they're wondering why their Achilles hurts or their calf hurts or, they flared up their back. It's because, we are naturally now on a downhill slide, and we need to make sure we're doing that extra work. Sure, you're 16 to 20, 22, you have a 1 month off, you're not going to notice it. You will kind of bounce back and just get straight into the thick of it. without batting an eyelid. But as we get older and the older we get, the harder it is for us to come back from injuries that generally last more than a month.
Yeah, I agree with that. I think there's some really good comments there as well. So let's tackle the big question, and the big question is does musculoskeletal screening reduce injuries or actually improve performance? I don't know if you've read my notes, Nick, or whether you've kind of read into this as well. But what's your thoughts? Do you think that it does?
Um, I my gut feel tells me, and I'm only basing this off one paper that I read probably about half a dozen years ago now, was that when looking at ACL injuries and hamstring injuries in particular, the screening probably didn't matter so much. It had a negligible effect on the impact of future injuries. But that was kind of the closing statement, is that what screening can provide is a nice open conversation and diving into the history of the person to allow us to plan their rehab better or to work out things. But that's kind of what I've read and know. So if you've got anything new and exciting for me, I'm happy to and willing to change my mind.
Yeah, you're definitely on the right track. Musculoskeletal screenings can detect risk factors, but no perfect injury prediction model from these screenings exists. But I think that there's a couple of points to really consider for that as well, because the research has been over the last 20 years, as I discussed a little bit earlier. Back in the day, they were very raw tests of basically going tip to toe and looking at every single joint, and things have progressed in recent times. So now we're using AI and, the tech that's kind of out there to kind of look for movement discrepancies, etc. So I think that's a really important thing, is to saying, all right, if the paper was written 15 years ago, does it actually apply to what's being done today? I think that the second thing, and it follows on beautifully from your point, Mick, and that is that is it the screening that's the important bit, or is it the actual doing that's the important bit? And that's where a lot of these studies have kind of fallen down, where they've looked at the screening and said, yep, these are all the errors that they kind of like need to be addressed and fixed up for you to prevent injuries in the past. But have those athletes done it? Have those athletes actually improved their neuromuscular strength? Have they improved their quad strength? Is their jump and land better than what it used to be? Because the screening may have picked it up, but if they didn't do the work, then they're still going to kind of get injured. And as we discussed in the injury prevention episode in the last one, these injury prevention activities and exercises do work if they're done regularly. And I think the takeaway message from the injury prevention stuff that we spoke about last time was that if you're compliant and you're doing it regularly, it will make a significant difference. And I think the point here is that you got to do it as well. So if you do go and get a musculoskeletal screening, areas are identified that need to be addressed, then make sure you do your homework and be compliant with it and do it regularly. Yeah, what do you think?
Oh, I agree, 100%. And it's also too, the onus is also on the clinician conducting the screening. There's no point just having a patient come in to see you or an athlete come in to see you. You work through your checklist of things you're looking at. And if you're not, really mindful of if there's a limitation at the ankle, say they've got a needle wall test that's 5 centimeters different from the other, you fail to ask them, have you got a chronic ankle injury history? Have you had a previous ankle fracture? And you're just noting down there's a 5 centimeter difference that we know will affect that person's ability to shock absorb. And, if you're losing 5 centimeters of range, there's no doubt you've probably got some reduced calf capacity as well. But if you're just sort of ticking those boxes, rolling through the motions and not giving that person some specific advice, then that's on us, and that's just screening for the sake of screening. If we are going to screen our athletes and our patients that walk in, we just need to make sure we're intervening with something. And that's not to say you need to go find problems as well. I think that's it creates some dependency and some unnecessary kind of things being done. That is certainly highlighting some things that the person can work on independently as well, and making sure they can do things without a whole lot of extra expense added to their days and their weeks. I think the interesting thing about this too is, I think, mate, just building on your point about injury prevention, the screening processes and their kind of knock-on effect on injury risk. I think that's probably the other deeper conversation, is about, because we have identified a problem, will it necessarily, should we then go in and target this person or this group of people to perform this particular program? And I think that's also too an important, that probably goes back to our injury prevention programs, is that yes, you might find some things, but if you're working at a team level and a group level, I think it's probably less about, that one particular person getting all those exercises and this group of people not doing that exercises. It's the whole group get the vaccine, so to speak. So that's probably going back to our injury prevention program talk, but this is more so at an individual level. Individual levels, we need to act on what we find. At a group level, I firmly believe that we should be giving everyone the benefits of the exercises we want to intervene with.
I'd like to put forward kind of a hybrid approach. So let's just use an example that you've got an 18-year-old footballer who's come in. They've got a previous history of having an ACL when they were 15, and then they've also had, 2 hamstring strains kind of playing also. When you screen these people, you're clearly going to focus in kind of like on the lower limb for their sport. You're going to look at how their knee is functioning, how strong their hamstrings are. And if there are unique differences kind of between, their left versus right hamstring strength, or they've got really poor kind of core control, etc., you need to give them some individualized kind of interventions and exercises to address those. But I totally agree with you that the conversation that you want to have with their current football club is that not only is this athlete prone to having another hamstring and another ACL, because that's what the literature tells us, your whole group is. So we suggest that you're doing your Nordics, you're doing kind of like the FIFA or the PEP program or something like that. But Joe, who's kind of, maybe got a couple of other things needs to be addressed, these are 3 or 4 different exercises that I'd like to have baked into his dryland, day-to-day gym program to make sure that he's being specific to himself as well.
Yep. Yep. And I agree. And I think part of that conversation also too is making sure the athlete, there's no better person to sort of drive home these points to if they're going to really have successful outcomes and be on the park or the court week in, week out and have that nice consistency in the training. They have to have that buy-in too. I think that's an important part, is that we are educating all the athlete as well as, coaching staff, family members, blah, blah, blah.
Exactly. And I think that's a really important thing, because athletes and people who are sporty, you need a good team of people around you. And, this is a great opportunity for those who are not practitioners out there, but actually active people, is to try before you buy. And that is to go and meet, different S&C coaches, physios, get a screening done, see what they've got to say. Do you gel with this person? Can you work with them in a preventative way and get them to help you with your program? No different to the mechanic who's doing a service for your car. So if in the unfortunate situation that you do have an injury, at least you've got someone great on your team who knows your body and knows what you're doing. And that's what happens when you're a physio kind of working in elite sport as well, is that you understand that player before they get injured. So if they do get injured, you kind of know, has this person responded to this exercise? Are they a really good aerobic animal, or are they a strength-based athlete? That understanding from the practitioner's point of view is really powerful. So, I think that there's a lot of benefit other than the prescriptive medicine side of kind of giving exercises, that if you can work in with really good people, they can help you on a number of levels rather than just giving you a great program.
Yep. Great points. Great point.
We've kind of thrown a bunch of terms around over the last couple of episodes between musculoskeletal screening, injury prevention programs, and prehab. So I think that we probably just need to go back to the start in some ways a little bit and just redefine those, Mick, just so people kind of understand the differences between them. So musculoskeletal screening is a test that identifies potential risk factors, but doesn't really fix them directly. Whereas injury prevention programs are standardized routines that are given to athletes and teams to reduce their injuries. And we've spoken about the FIFA 11, etc. Prehab is slightly different, where it's more so, this is the way I interpret it anyway, is it's a little bit more personalized. Prehab back in the day just used to be kind of getting ready for like surgery or that kind of thing. But now the term's kind of more so encapsulated anything to do with preventing injuries. So that's where I was talking about before, is a prehab program is part of an injury prevention program, and that can be partly like an off-the-shelf FIFA 11, for instance, but partly personalised as well. Would you have any differentiation to any of those definitions, mate?
No, that's a really nice, clear sort of sequence of terms. I think it's really, yeah, you couldn't sort of describe it any better than that. I like how, yeah, because prehab often is a term that's thrown out there, and a lot of individual athletes would, being around clubs and sporting teams enough over the years, they probably understand what prehab is. And often, when I was working with the netball, each of the players, like what you described, we'd have our netball knee program that we'd roll out at a group level. But the often conversation was like to each athlete, that would often be expected to turn up, probably 10, 15 minutes before training started, that have you done your prehab exercises? Each person had their own little individual things to work on based on their injury history and their profile. So yeah, I think that term prehab is a really nice way to differentiate between an individual program and then also to the team program.
Yeah, and it's not our area, but I suppose we should just touch on that this is essentially, this is quite different to your typical medical screenings that you'll get, before you start like at a gym or start with a new sports team, for instance, where they will check you medically for heart conditions, etc. So this is a musculoskeletal screening, which is really just about musculoskeletal issues and not more serious kind of complications, cardiovascular, etc.
Yeah, great point. If I can just extend on one little thing that I've flagged up before about the family history, I think this is a really interesting one. We've all talked about, screening individual levels and implementing at individual and group level. One of the simplest questions we can ask our group of athletes or our individual athletes when we turn up for a screening process: has your mum or dad injured their ACL in the past, or their brother and sister? The risk of re-injury is 2 times greater if your mum and dad, brother or sister have injured their, and that accounts for the fact that mum and dad also played soccer and mum and dad did play touch or whatever sport that young kid is playing. It's not the fact that, they're playing a high risk sport. It's the fact that, and mum and dad also played those high risk sports. It's the simple fact that genetics is playing a role. And assessing for hypermobility. It's the old Baton's examination, which, should be part of a good musculoskeletal process anyway. Hypermobility certainly is a really simple thing that we could do to have a look at a nice injury risk profile. But yeah, the old family history question is a really important one.
It is important, and it should be. I mean, a lot of it centers around collagen, obviously, and ACLs. But you'll also see people who have got tendon issues throughout the family, who have got hypermobility issues throughout the family, who have got really stiff, hypomobility of kind of certain areas as well.
Yeah,
propensity to osteoarthritis,
dislocations.
Yeah, you can pick your friends, but you can't pick your parents. And it can be very frustrating for people in sport, that's for sure. But you dealt the cards you dealt with.
Exactly right.
I thought that was a really good discussion, Mick. So thanks again for another terrific one. I really enjoyed it.
I could get used to these little 30-minute chats we're having every now and then. We might have to come back and do episode 4 soon.
We will. All right, we'll get into that soon. But that's a wrap for today's episode of Exercise Matters. If you enjoyed the chat, make sure to subscribe, leave a review, and share it with your mates. A quick disclaimer, this podcast is for educational purposes only and not medical individual advice. Always seek guidance from a qualified health professional for your specific needs. Big thanks to the sponsors, Premax, high performance skincare for high performance people, and Learn.physio, world-class education for health professionals. Catch you next time.